Hello friends, I am Dr. Ajay Kothari. I am a consultant spine surgeon at Sancheti Hospital, Pune. Today we are going to talk about spinal vertebral hemangiomas. Now hemangiomas are most common primary tumors of spine. They are benign tumors and they have a vascular origin. It is a very common incidental finding. So if you analyze 100 MRIs, 26 of those 100 MRIs will have an incidental hemangioma. But 99% they are not symptomatic. Of the 100 hemangiomas seen, only 1 to 1.2% hemangiomas are symptomatic. So they are benign tumors of vertebral origin. They are primary vertebral spinal tumors and they have got vascular origin. What are the symptoms? Usually they are asymptomatic, as I just said, but if at all symptoms arise, it can be back pain, and if the hemangioma enters into the spinal canal and causes cord compression, then it can lead to radicular symptoms, myelopathy, neurodeficit, weakness in upper limbs or lower limbs, or even urine or motion control loss. What are the other differentials? Means if you see such lesion, what other things should come to a physician's mind? Number 1, it can be infection. Number 2, it can be metastasis, that is cancer which is spread from other parts of the body to this. Number 3, it can be an osteoporotic fracture. Or number 4, some other primary vertebral bony tumor. Clinical examination is very important. And in early cases, if it is symptomatic, there is a focal tenderness at the area where the pain is there. Range of motion is terminally restricted and painful. You can do nerve root stretch test time, range of motion tests, and if at all neurodeficit is there in that particular segment of root, the deficit can happen. And if it's a cord level, then long track signs can be positive, hyperreflexia can be there, weakness in the legs or upper limbs can be there, and plantar reflexes will be extensor. Now, how do you diagnose hemangioma? So, diagnosis is number 1 clinical, and to support the clinical diagnosis, there are investigations like X-ray, CT, MRI, and triphasic nuclear bone scan. But usually, an X-ray plus an MRI with additional CT cuts usually give us the diagnosis. So there are few adjectives which have been used in diagnosis, and they are called polka dot sign, corduroy appearance, or jail bar appearance. Because of the sclerotic bony bands, it gives a jail bar appearance or a corduroy appearance. What is the treatment? Treatment, usually these are asymptomatic and they don't need any treatment. They just need observation and educate the patient of the red flags, what can happen, and if at all it happens, immediately report to the doctor. But if the vertebral hemangiomas are symptomatic, then the treatment varies. Number 1, from a endovascular embolization, which is done by a interventional radiologist, and the feeder vessel which is causing the hemangioma is blocked and the treatment is done. Second, if the body is symptomatic, painful, then there is a treatment of cement injection in the body, which is a percutaneous treatment, daycare procedure, which is vertebroplasty. Very rarely, if there is an extension of the hemangioma into the vertebral canal and there is a neurodeficit, then it involves stabilization, vertebroplasty, and doing a laminectomy and decompression of that hemangioma mass, or even in some cases, a complete en bloc resection of the vertebral body along with stabilization is necessary.
Hi, I'm Hitesh Chitnis. We have my son Chinmay Chitnis admitted to Sancheti Hospital for his spine surgery. We detected this abnormality in the last 8 to 10 days, and post the MRI and spine MRIs, we got to know that Dr. Ajay Kothari was one of the best surgeons here. So we referred to him and we came to him, and we got his opinion. He gave us a lot of confidence on the way the surgery is to be conducted. He explained us all the steps that he would be taking up, and also the kind of technology that we will be using, the latest technology which the hospital uses for such kind of surgeries. So we did put in a lot of faith in him and his team, and that has worked. The surgery was very successful, and we are quite happy with the team. And Chinmay is also showing great signs of recovery, so it's just a matter of time before he finally gains his strength in his legs. And yeah, thank you, Dr. Kothari and the team. Thank you so much.